welcome to have more babies. As parents, it's always worrying when our kids aren't quite right.
Mm.
And today, we're going to talk about something pretty common, actually.
Mhm.
Urinary tract infections, or UTIs, in children.
That's right.
We want to really get into what they are, why they happen, maybe how you can spot the signs, because sometimes they're subtle, right?
Yeah,
And crucially, what you need to do about it.
absolutely. UTIs, they're more prevalent than many people think in childhood. And honestly, just having the right information can make such a difference. Getting your little one help quickly.
Definitely.
So maybe let's start right at the beginning. What exactly is a UTI? What are we talking about here?
Okay, yeah. So imagine the urinary system. It's like our body's super efficient cleaning system.
Right.
You've got the kidneys, they do the filtering work. Then the ureters, those are the tubes carrying the waste, the urine, down to the bladder where it's stored.
Yeah.
And then the urethra is the exit pipe, basically. A UTI just means there's some kind of inflammation, an infection somewhere in that system.
Precisely. And usually, almost always, that inflammation is caused by bacteria. They've somehow gotten into the urinary tract.
Okay.
Now, technically, it could be anywhere, but most often it's the bladder. We call that cystitis.
Cystitis. Right.
Less commonly, it might just be the urethra that's urethritis. Or, and this is more serious, it can travel up to the kidneys. That's pyelonephritis. But here's something important. UTIs, they aren't contagious like, say, a cold.
Oh, that's good to know. So
Yeah.
they're not catching it from, like, daycare buddies or siblings.
No, exactly. The bacteria that cause the trouble, they usually come from the child's own gut.
Really?
Yeah, think about it. Bacteria from a bowel movement, it's not a long journey to the urethral opening, especially anatomically speaking.
Right.
And this is a big reason why girls tend to get them more often. Their urethra is shorter, and it's just physically closer to the rectum and the vagina, so easier access for bacteria.
That makes a lot of sense.
Yeah, studies show before puberty hits, girls are quite a bit more likely to get a UTI compared to boys.
Okay, so that anatomical difference is key. You mentioned girls being more prone.
Mm.
What other things might put a child at a higher risk for getting a UTI?
Well, yeah, sex and anatomy, that's a big one we just covered.
Yeah.
Age is another really significant factor.
Age, how so?
Infants and preschoolers, that group actually has the highest risk. And, potty training,
Oh, yeah?
while it's a huge milestone, that period can also mean increased risk. Kids are learning about hygiene, how to wipe properly.
Well, front to back, yeah.
Exactly. And sometimes getting that wrong can, well, it can contribute. It's funny how small details like that matter, isn't it?
It really is. Those little things you don't always think about. Are there any underlying medical issues that might make a difference?
Yes, absolutely.
Mhm.
If a child has any kind of structural abnormality in their urinary tract, that can increase the risk.
Like what kind of things?
Things like blockages, maybe, that stop urine flowing normally, or
Mhm.
something called vesicoretral reflux. That's where urine flows backwards from the udder up towards the kidney sometimes, or even problems with valves in the system. And family history can play a role, too. If a close family member had UTIs as a child, their child might be slightly more likely to have them.
Interesting. And what about everyday stuff? I've heard people mention bubble baths. Is that a real thing?
It can be, yeah. Lots of bubble baths or staying in them a long time can sometimes irritate the sensitive area around the urethra, and that irritation might just make it a bit easier for bacteria to get a foothold.
Okay.
Same idea with tight clothing. Think wet swimsuits left on too long or really tight underwear. If it traps moisture, it creates a kind of warm, damp environment where bacteria can, thrive.
Right. That makes sense. And you mentioned the gut earlier. How do things like constipation link into this?
Yeah, it's an interesting link. If a child is often constipated or maybe has frequent diarrhea, it can kind of mess with the normal balance of bacteria in their gut. And sometimes that imbalance lets the UTI-causing types of bacteria multiply more. If those then migrate, you see the connection. It shows how different body systems are all tied together.
Wow. Okay. So we've got a clearer picture of what UTIs are and who might be more at risk. Let's talk about spotting them. What signs should parents be watching for? I know you said it can be different depending on how old the child is.
Absolutely. The symptoms really do vary. And it's so crucial to remember the only way to know for sure if it's a UTI is through a medical test.
Right. Diagnosis is key.
Definitely. But knowing the signs helps you know when to seek that help. So for older kids, the ones who can tell you what's wrong,
Yeah.
common things are like a burning feeling or actual pain when they pee, or suddenly needing to go right now, that urgency, or needing to pee really often, but only tiny amounts come out. You might also notice changes in the urine itself. Maybe it looks pinkish or red, even kind of brownish like cola, or it just smells really strong or bad.
Bowel odor, yeah.
And sometimes they'll complain of pain, like lower tummy pain or back pain. A fever is common too, say over 100.4 Fahrenheit or 38 Celsius. Plus, general stuff like just being really tired, maybe confused or extra irritable, even nausea or vomiting sometimes.
Okay, those seem like things you'd probably notice in an older child. But what about babies? They can't exactly tell you it burns when I pee.
No, they can't. And that's why it's trickier with infants. The signs are often much less specific.
Like what?
You might just see them being more fussy or crying more, especially maybe when you're changing their diaper, touching that area.
Oh.
Or maybe they're spitting up more than usual or vomiting. Poor feeding, not wanting to eat, maybe not gaining weight well. Sometimes just a fever with no other obvious cause, no cough, no runny nose, that could be it. Even jaundice, that yellowy skin tint, can occasionally point to a UTI in a baby.
Wow. So it's really about noticing any change from their normal baseline.
Exactly. Changes in behavior, feeding, just their overall well-being.
And toddlers, that in-between stage.
Yeah, toddlers can be a mix. You might suddenly see accidents. A child who was dry starts wetting the bed again, or having daytime accidents.
Okay.
They might also do that frequent peeing of tiny amounts thing, or complain their, private parts hurt or feel itchy. Sometimes it shows up as just being more confused or agitated, maybe unexplained tantrums or crying fits, or even chills, body aches, headaches sometimes.
That's a really useful breakdown. So if a parent does suspect a UTI based on these signs, what should they have ready when they talk to the pediatrician? What info is helpful?
Yeah, being prepared helps a lot. Try to pinpoint exactly when the symptoms seem to start. Was there anything going on around that time? Does your child have a history of UTIs? That's important too.
Okay.
And then just observations. Does anything seem to make it better or worse? Like, does drinking more water seem to ease things? Is the pain worse at certain times? That kind of detail really helps the doctor figure things out.
Got it. Okay, so let's say you suspect a UTI. You call the doctor. What usually happens next? How do they diagnose and treat it?
Right. The first and most important step is contacting that pediatrician quickly.
Not wait and see.
No, prompt diagnosis and treatment are really key. It helps your child feel better faster, obviously, but it also prevents potential complications like the infection spreading to the kidneys, which we want to avoid.
Right.
So the doctor will likely start by asking lots of questions about the symptoms, your child's health history, maybe check their growth. They'll do a physical exam too, partly to rule out other things. But the main event for diagnosis is getting a urine sample.
The dreaded pee sample.
Ah, yes. Sometimes tricky to get, especially from little ones, but it's essential. Needs to be a clean catch if possible to avoid contamination.
And what are they actually looking for in that sample?
They run tests on it called a urinalysis. They're looking mainly for bacteria, that's the big clue. They also check for white blood cells. A high count means the body's fighting an infection, there's inflammation. They might also look for traces of blood or pus and just note the urine's color and smell. If they find bacteria, and often those white blood cells, that confirms the UTI.
And does knowing the specific bacteria help?
Yes, sometimes they'll do a urine culture as well to grow the bacteria and identify exactly which type it is. That helps them choose the best antibiotic to fight it.
Right, so antibiotics are the standard fix.
Yes, for most childhood UTIs, oral antibiotics are the primary treatment.
How long do they usually have to take them?
Typically, it's about 5 to 7 days. Maybe a bit longer, like 10 days, if it's a more serious infection, especially a kidney one.
Okay.
And this is super important. You must finish the entire course of antibiotics, even if your child seems totally better after just a couple of days.
Why is that so critical?
If you stop early, some bacteria might survive, the infection could come right back, and it also contributes to the bigger problem of antibiotic resistance. So finish the bottle.
Got it. Finish the whole course. Are there other things parents can do at home to help their child feel better while the antibiotics work?
Oh, definitely. Supportive care helps a lot. Number one is fluids. Encourage them to drink plenty of water, mainly. Helps flush things out.
Okay.
You can also give them pain and fever relief if needed. Things like acetaminophen or ibuprofen, whatever's appropriate for their age. Check with your doctor or pharmacist if unsure.
Makes sense.
Warm baths can be really soothing too. And reinforcing good hygiene wiping front to back for girls. Plus, stick to loose, cotton underwear and clothing. Let the area breathe.
Any foods or drinks to avoid?
There's not a lot of hard evidence, but some people find that really sugary drinks or maybe very acidic things can sometimes irritate the bladder. Probably best to stick to water mostly.
Good advice. What if the symptoms don't get better after starting antibiotics?
Hmm.
Or they come back after finishing?
Yeah, that's important. You should definitely follow up with the pediatrician if things aren't improving within, say, 48 hours of starting the medicine, or if the symptoms seem to return after the course is finished.
That's right.
And although it's rare, a UTI can sometimes become a really serious blood infection called urosepsis. You need immediate medical help, like ER-level help if your child shows signs like difficulty breathing, being incredibly sleepy or hard to wake up, a very high fever with chills, or seems confused or mentally off.
Okay, that sounds scary, but good to know the warning signs.
It is scary, but thankfully very rare. The good news is the vast, vast majority of childhood UTIs, when they're caught and treated promptly, clear up completely with no lasting problems at all.
That is definitely reassuring for parents. And look, if you're listening and you want to read more about this, get more detailed information, find reliable resources on UTIs in kids, we really recommend checking out omegapediatrics.com.
Yes, that's an excellent resource. Lots of great info there.
Omegapediatrics.com. Definitely worth a visit. So just to kind of wrap up our chat today, UTIs, they happen in kids. They're common.
Right.
Spotting the signs early, getting that medical help quickly, that's really the key.
Absolute crucial.
And there are things you can do at home to help them feel better and maybe even lower the risk a bit. But bottom line, if you have any concern that your child might have a UTI, just call your pediatrician. Don't hesitate.
Exactly. Always best to check it out. Trust your gut as a parent and seek that professional advice.
Well, thank you so much for walking us through all that. Really helpful information.
My pleasure.
And for everyone listening, if you found this deep dive useful, please do give this video a like, subscribe to our channel, have more babies for more discussions like this, and please share this with any other parents, grandparents, caregivers, anyone who might benefit from knowing this stuff.
Goodbye, everyone. Stay well.
Until next time, have more babies.